We're spending 48% of federal spending on healthcare. And then you're spending...
Not enough. It's the most important thing. What could be more important than health?
And then you're spending $20,000 on health insurance, and then you're told a bill is not covered and they're going to sue you in court. This system is so crazy. There are sometimes things need to shatter before we realize we need to pick up the pieces and start over. And that is what's happening right now with employers that are doing direct contracting, patient steering from their own primary care clinics, direct primary care. Steering is one of the great holy grails, I think, of healthcare. If we can have steering from primary care, from employers and even health plans to high-value centers and high-value doctors, recognizing we need good care in rural areas, we can actually create demand around value. And we're seeing employers now. Walmart just announced they're opening up a clinic. What do you think's going on with some of that logic? They will be able to control referrals. And by controlling referrals, that means their doctors can refer to the other specialist doctors, which tend to be the expensive docs, that are doing appropriate care with fair pricing. We've seen it with ChenMed. We see it with Iora. We see it with large employers doing DPC or direct primary care. It's one of the great bright spots going on right now. And they can take time to get into your chronic illness because they're paid on a global capitation. They're not doing the billing throughput model of primary care, which is so broken and so ridiculous. Patients hate it. We doctors hate it. Our burnout rates as doctors are at record highs. Why are we doing it? It's so broken. To see a patient for 10 minutes and spend 5 minutes billing and coding. A study came out showing that we doctors are doing our charting on nights and Saturdays. That's how much this crazy coding billing game is. These clinics are saying no more billing. We're going to convert our billing room into a cooking class for patients with diabetes. We're going to talk about treating back pain with ice and physical therapy instead of surgery and opioids. We're going to look at the specialists in our community and refer to the ones that are doing high-value care and don't do those unnecessary nudges and leg stents and endoscopies and knee arthroscopies that don't have any benefit. That is the great value marketplace that is already being carved out by some of these employers. That is one of the great reasons I'm optimistic about healthcare and the real privilege of profiling these innovators in the book, The Price We Pay.